hiccups, intractable hiccups, red urine, which you might think I'm dying.
That must be caused by... Hey friends, welcome back to my channel. My name's Aina and I'm an oncology pharmacist. I've been working in cancer treatment for a number of years now, but I've never had the chance to actually listen to a patient's full cancer story. We read notes from different practitioners and we try to piece together the information. So when I saw Hank Green sharing so much about his cancer publicly from the day of diagnosis to the day of his final chemotherapy, I thought that this might be the most generous thing anyone can ever do. So today I wanted to make a video to watch through Hank's full cancer journey for the very first time and learn about what he had to go through to fight cancer.
So I noticed that my lymph nodes were big. I talked to my doctor. She says probably nothing. We'll send you in for an ultrasound. Got an ultrasound. The tech in the ultrasound room was like, I'm gonna go get a doctor. That's not what you want to have happen.
No, probably not.
She was great, the tech, and so was the doctor. And they were like, this looks like it could be suspicious for lymphoma, and we'll get you in for a biopsy.
The ultrasound technicians are trained to read imaging results. They just can't diagnose patients or tell them, hey, I think you've got this. It sounds like though that they were able to call a doctor in right away, which is amazing for more urgent cases like this. But in a lot of community ultrasound places, especially in Canada, I don't think they have a doctor nearby. So what would need to happen is the ultrasound place needs to send the results back to the physician. The physician would then have to call Hank in for an appointment and tell him the news. So that would add at least another few days to the process. On the ultrasound, what they can probably see is something called lymphadenopathy, which means swelling of the lymph nodes. But of course, a biopsy will be needed for a definitive diagnosis.
Good news, bad news. One, it's cancer. It's called lymphoma. It's a cancer of the lymphatic system. And good news is something called Hodgkin's lymphoma. It's the most treatable, like one of the most treatable cancers. The goal is cure.
Lymphoma is a type of a cancer in the immune system, and immunology is super confusing. I'm pretty sure I've said that line before. I think in Iron Mouse immunodeficient video that I made. You can go check that out if you haven't yet and come back to this later. Lymphoma is possibly one of the most complex types of cancer with many different subtypes. But basically the main subtypes are Hodgkin lymphoma, which accounts for about 10% of all lymphomas, and non-Hodgkin lymphoma, which accounts for about 90% of all lymphomas. What Hodgkin lymphoma really is the infiltration of the lymph nodes by these weird, bizarre-looking cells called HRS cells. We call them having an owl's eye because they look something like this. Funny tip, I used to call them Hedwig cells when I was trying to memorize this because Hedwig is an owl and it starts with the letter H, and so does Hodgkin. And the original cells that went wrong and became mutated to produce these Hedwig cells are B cells, which is a type of immune cells to fight off infections. Wow, B cell issues again, hey? Causing a lot of havoc out there. So through a bunch of mutations, B cells no longer become more normal B cells. They transform into the HRS cells. And they also have the ability to evade your own immune system, so they don't get killed. And this leads to Hodgkin lymphoma.
Treatment is a fairly well-established system of chemotherapies, which I'm gonna start very soon. Not looking really forward to it, but I'm looking forward to starting on the path. Yeah, prognosis is very good for people with Hodgkin's lymphoma. It seems likely that we caught mine early. I'm still waiting on a scan to sort of confirm that.
Obviously, we all know this, but the earlier you start chemotherapy after diagnosis, the better it is for your prognosis. But unfortunately, a lot of the times, a delay in treatment can happen, not because the patient doesn't get to see the doctor, because the cancer center can't accommodate a patient's chemotherapy treatment. I've seen situations where the doctor is almost begging the booking team to add his or her patient to the treatment list for tomorrow. And unfortunately, I've seen patients being delayed on treatment for days just because there's not enough spots.
This is a blood cancer, so it's a cancer of the immune cells, the lymphocytes. And so they are already all over the body. Other parts of the body are like, hey, yo, that you're fine here. Whereas like prostate cells in the lungs would normally get attacked. It's not the same giant gap between like stage 1 and stage 4 with lymphoma as it is with solid mass tumors.
Hank already explained this super well, but cancer is usually stage 1 to 4. Stage 4 usually means metastases, which means the cancer has already traveled to a distant part of the body. Every type of cancer is staged differently, but for lymphoma, Stage 1 means it involves one lymph node, and all the way through stage 4, which means it involves organs outside of the lymphatic system. In Hodgkin lymphoma's case, we would consider stage 1 and 2 limited disease and stage 3 and 4 advanced disease.
Anyway, I have a bunch of risk factors for lymphoma, including medications I've taken, including the fact that I have an autoimmune disease, including the fact that I had mono when I was a kid. All these are risk factors. So it was something that I was looking out for and have been aware of. I'm glad everybody took it seriously.
That's super interesting. The fact that he already knows he's at a higher risk for lymphoma, that must mean that his healthcare provider, whether it's his family doctor or his specialist, has told him about this possibility, which I think is a very responsible thing to do. I mean, you might wonder if this is really a good idea. If it only increases his chance slightly, do we really want to scare him with stuff like this? Well, the positives of telling someone that they're at a higher risk for something is so they know what to watch out for. A big part of how Hank was able to catch his cancer early, I think, is that he recognized the big lymph nodes. I mean, I think to a lot of people, they might not think too much of it, right? Because if you get a cold or an infection, you might have bigger lymph nodes. Also, stress from a person's life can cause night sweats and weight loss, right? But these are also some classic symptoms of Hodgkin lymphoma. So the fact that he is aware of these and knows to alert his medical team means that they have been very responsible about his condition. So he says his risk factors are 1, autoimmune disease, which are basically when your immune system attacks yourself. The other risk factor, he said, is having mono as a kid. Mono is famously known as the kissing disease, but it comes from a virus called the Epstein-Barr virus. Yes, that is the same last name. The virus is like kind of crazy. There's no vaccine for it. And once you get it, it lives in your body forever. It can cause a lot of complicated issues down the line, like multiple sclerosis, which is a condition where your immune system attacks the protective covering of nerve cells, and lymphoma. So in a lot of patients, they have found Epstein-Barr virus genetic information in these weird, bizarre Hedwig cells, which means basically these viruses hide in someone's body, somehow replace the genetic information of these B cells and turn them into Hedwig cells, which causes Hodgkin lymphoma.
But the moment I start chemo, I'm gonna feel a lot of symptoms from that. And they're like, that's gonna be like, just dealing with that is going to be a lot, and you're not going to be good at stuff. You're not going to be good at stuff. Chemo is intentionally poisoning your body so that the super hungry cells get poisoned more and die.
Whenever I walk into the chemo treatment room, I see a very wide range. Some patients are taking a nap during their infusion. Some are working away on their laptop like there is no poisonous fluid going into their body. Obviously, it depends on what specific chemo drugs the patient is getting as well, so I'm curious to find out if Hank talks about that.
Chemotherapy targets cancer cells really specifically, but not so specifically that it doesn't also get a bunch of the good guys. But I was 100% on board with chemo, and it's definitely extended my life. It's probably saved my life, and I'll die of some other thing. And 3 out of the 4 chemo drugs that I was on are natural. They're from nature. Vinblastine comes from the Madagascar periwinkle. It's just in a cute little flower. It was known to the indigenous people in Madagascar. Scientists checked it out and found that it had a bunch of anti-cancer properties.
I didn't know that, and I'm so glad to learn something from Hank. Vinblastine is something we call a mitotic inhibitor, which means it stops cells from dividing, which sounds dangerous, right? It is. This drug is potentially so fatal that every prepared bag of vinblastine that we make from the pharmacy needs to be slapped with a big red warning label that says fatal if given any other route. That's because more than 50 cases of death has been caused between somewhere in the 1960s to 2007 because this IV drug, which is supposed to be given intravenously, has been accidentally given intrathecally, which means shooting it directly up the spine. How did such an accident happen? Well, I don't know, but let me tell you, medical errors can happen. Vinblastine can also be used to treat certain types of bladder cancer or certain types of sarcoma. With cancer treatment, it's kind of like playing a game of Scrabbles. You have all these chemo drugs laid in front of you, like the letters that you would have, and you pick and choose the ones that are best suited to make up your word. So in this case, your treatment protocol. Of course, this is just a very simple analogy for something really complicated.
Another one, adriamycin, also called doxorubicin, was found in microbes in the soil at the base of an Italian castle.
I didn't know that either, but that sounds very specific. Doxorubicin is really easy to remember because it has this really strong bright red color. No joke, it actually looks like there's red 40 dye in there. And the name doxorubicin sounds like it has the word ruby in there, so that's how I make the connection in my mind. But doxorubicin can cause cardiotoxicity, which means toxic to the heart. So there's actually a lifetime maximum dose that we can give someone doxorubicin. So if the patient's cancer unfortunately comes back, we typically would have to pick a different treatment that does not contain doxorubicin.
Third, bleomycin was also found in a soil microbe called Streptomyces verticillus. Soil microbes have been known for centuries to have antibacterial properties. People would pack wounds with specific soils because they knew that those soils would prevent infection. They didn't know why, but they knew that they would. And the reason why is that a lot of bacteria produce antibiotic compounds to compete with other bacteria. And it turns out a lot of antibiotics are also good chemotherapies because they work by messing with cells' ability to replicate themselves.
So bleomycin can cause some really rare but serious toxicity to the lungs. I remember there was this one patient who is an avid scuba diving lover, but he was about to start his treatment that contains bleomycin, and he asked if he could still go on his scuba diving trip. So of course the doctor had to consult with the pharmacist, and we all had to come together to make a good treatment plan for this patient. Okay, at this point I'm pretty sure Hank's treatment consists of something called ABVD. Oh yeah, in cancer treatment we love using letters. Don't ask me why. So ABVD, that's doxorubicin, bleomycin, vinblastine, and dacarbazine. All of these drugs are given day 1 and day 15 of a 28-day cycle.
During the time when I was publicly living with cancer and talking about cancer treatment, I received almost universally good vibes. Like, I just want to be clear about that. People were amazing. But I did get some folks who would come to me and say that I would have a better outcome and be healthier if I took a more natural route, by which they meant that I should not be doing chemotherapies. I gotta be clear here too.
No.
When it comes to like Epsom salt baths and acupuncture during chemotherapy, yes, I'm in favor of all of that. If you want to do it and your doctor is telling you it's not going to do any harm and you feel like it's going to do good, do it. I took Epsom salt baths. I don't know if it was any good, but it was like a chance to take a big long bath and feel like I was doing something for myself. And there are also supplements that we know don't hurt and we think might help. Like I took fish oil, I took vitamin D, I took magnesium, especially the magnesium I think helps. I was getting muscle cramps. That cleared up after I took magnesium supplements. As long as you're talking to your doctor about it and it doesn't look like there's negative consequences, I say do it.
Wow, so nicely put. Most of the patients that we see want to receive chemo, but on top of that, they also want to be on some natural products. When patients talk to their doctors about these natural products, 99% of the time, it means that the doctor comes to the pharmacist because the pharmacists are the ones that actually know what's going to happen with the interactions. So sometimes we see that patients, in addition to seeing their cancer treatment team, like their oncologist, their pharmacist, they also see a natural path to get prescribed natural or herbal supplements. But there are 3 main problems with natural supplements. First, a lot of them actually interact with the cancer treatment that the patient is getting, making them less effective. For example, a lot of supplements are antioxidants, which are advertised to help your body by inhibiting a process called oxidation. Oxidation is a natural process in your body which causes free radicals. And when free radical levels are too high, they can actually be harmful. However, many chemotherapy drugs work by actually causing oxidation, actively producing a lot of these free radicals to kill the tumor cells. So if a patient takes antioxidant, theoretically, it can make the chemotherapy less effective. Second, it's actually very rarely that supplements are proven to work. They usually have a very small study design with very minimal patients enrolled, and the study duration is usually really short. And third, a lot of these supplements are insanely expensive. Now, I'm not sure if this happens when patients learn about their diagnosis and they just want to be in control of their body and they want to do anything and everything that they can to help. But I do notice an increasing number of cancer patients taking natural supplements.
Good morning, John. So the thing about the way that I'm getting chemotherapy is that they really dose you. They hit you super hard on Friday, and then you get one Friday off, and then they hit you super hard again on the Friday after that. And the whole idea of this is that the 4 different chemo drugs that I am taking, they do a good job of interfering with cells that are currently in the process of dividing a lot, which are cancer cells, but also some other cells, and so it makes you feel sick.
Right, so other rapidly dividing cells in the body are hair follicles. That's why people's hair fall off. And in the gut, that's why a lot of people have issues with nausea or diarrhea. And blood cells. So that's why people have low white blood cells and platelets, so they're easier to get an infection or have a bleed or bruise. Newer treatments though, called targeted therapy, will actually just target the cancer cells through certain mutations expressed on the cells, so they produce less harm to the rest of the body. But the treatment that Hank is getting are just traditional chemotherapy drugs.
And they want people to stay in treatment and not feel too bad. And they also want to minimize complications that you do get if you have too many negative side effects piled on top of each other. And so they let you recover. And I'm feeling so like normal right now before they smack you back down, which is happening at 9 a.m. tomorrow morning.
I think before I started practicing in oncology, this was my assumption. And I'm pretty sure a lot of the people might have the same assumption as well, is that the patients feel the most crappy with dizziness, fatigue, nausea, while getting the infusion running through their body in the chair. But that's actually not the case. Most patients feel fine the day that they get their treatment. There's something common called delayed nausea, which means getting nausea days after your chemo infusion. The heart toxicity from the doxorubicin and the lung toxicity from the bleomycin that we talked about previously can happen weeks to months to years after your treatment. So during treatment, the patient is being followed up really regularly, not just for disease progression, but also to monitor for these side effects and toxicities.
I mean, top 5 weirdest chemo side effects. Hiccups from the dexamethasone, which actually is kind of a chemotherapy drug, but mostly you take it to hold back nausea and feel a little bit better after getting your treatment. Hiccups, intractable hiccups. I probably had like 12 bouts of hiccups lasting more than 30 minutes over the course of 2 days. It's miserable.
Yeah, that's actually a thing. Dexamethasone is a steroid medication, and I know we immediately associate steroid meaning bad. But in cancer treatment, dexamethasone is super useful, and it's literally used in almost every single treatment protocol that I can think of. It gives people more energy and it gives them more appetite. It causes hiccups by stimulating the part of the brain that's literally called the hiccups reflex arc. One option is to switch the dexamethasone to methylprednisolone, which is another steroid, but it travels less to the brain.
Red urine, which you might think I'm dying, but in fact is just one of the drugs, is a red color, and it can come out in your urine and also your sweat.
That must be caused by the doxorubicin for sure. Remember that bright red one that I talked about earlier?
Last, this one is super normal, and I just had never heard about it, but your mouth gets sore. Like you can get so bad that you can get sores in your mouth, which hasn't happened to me, but your tongue feels bad and your under tongue, like everything in your mouth just feels sore.
To treat mouth sores, which can be a serious side effect because it might affect the patient's eating and drinking, which we don't want, and the mouth sores can actually lead to infections, which we really don't want. And the treatment for this is something called magic mouthwash. Yes, magic. Wow, we're staying so on brand with Harry Potter today. And this has to be compounded by a pharmacy. It is not commercially available. But honestly, it's really fun to make. It has a bunch of colorful ingredients that are mostly liquids, and you just pour them all together and you mix it. And the patient just swish their mouth with this to reduce the inflammation and reduce the chance of infection.
None of those, however, have been the worst side effects for chemo for me, is just the fatigue. It does not feel possible to be that tired. And I felt that bad. Like when I had COVID, it was a similar feeling of fatigue. It is hard to move your arm enough to grab the Gatorade bottle. Getting up to go to the bathroom was work.
I really appreciate Hank sharing all of the details about how he feels. Because in practice, a lot of the patients have a tendency to under-report their side effects. So to hear that even going to the bathroom is a lot of work when they're on treatment, it really gives me a deeper understanding of what patients are going through.
But the big one is fatigue, and then also the sort of interrelationship between fatigue and mental health stuff. So it's really hard for me to tell the difference, honestly, between fatigue and depression. And I don't even know what the difference is as a human being.
Also, I didn't think that this would happen to me, but I have a little tinge of the survivor guilt. I feel like I don't have any space to talk about cancer because it didn't hurt me enough. And I know that that's irrational, but so are a lot of my thoughts these days, and we're just working through them.
I really don't think we talk about this enough, but it would be so hard to not be affected mentally in any way when you get a diagnosis of cancer and then subsequently have to go through a whole treatment for the cancer. I mean, I've had patients who have had suicidal thoughts after getting the diagnosis of cancer. And there's something that I see significantly a lot more in oncology pharmacy practice compared to other specialties, which is called medical assistance in dying, or we abbreviate it to MAID. And the pharmacist would be responsible for making the kit of drugs that the doctor would give the patient so that they can die. This is something I will make a video about in the future.
I went from having one medicine to, my counter is right there is full of medicine, but then the bathroom counter is also full of medicine. It's wild. I've got areas of medicine. So there's an anti-nausea section, and then there's anxiety section, which I haven't been having to take, which is great. And then there's the other section where the heartburn medication is.
Most patients that come in to get their chemo treatments will actually carry a hospital bag, even though they're not staying in the hospital overnight. And in there would be bottles and bottles of medication that they need to take. I'll show you just the nausea supportive care medications that we give to patients, and you'll see what I mean. This whole table here is the list of nausea medications. I don't have anything else to say to Hank except for thank you. I gained so much insight and learned so many new things from Hank, even though I already work in cancer treatment, all the while being entertained and even laughed at times from his videos. Thanks for sharing it with all of us. If you enjoyed this video, please don't forget to give it a thumbs up and subscribe for more contents like this. That's it for today's video. I'll see you in the next one. Bye.